course, when it
30
comes to
minutes of
taking
friends
care of
talk
ourselves, it's very
about
important to keep in
everything that
mind
matters to
what we
women.
actually eat is very important
Welcome to
for
the
ourselves.
lounge.
Indeed,
Yes.
definitely, Hiba, and it also affects everything, especially talking, because we are women, definitely, hair loss or, sometimes weight loss, weight gain. This is it all affects
And
each
it
other.
actually also affects our mood very high and very intense. So with that, we're really happy to have you with us, Dr. Fawzia Al-Khaldi. Maybe at the beginning, you would like to tell us more about yourself.
Sure. So thank you for inviting me. It's a pleasure to always be with women and advocate for women health. So I'm a consultant physician. My major is internal medicine, and I've done a rare specialty of hematology. I had both double board, American and Canadian board, and I'm a fellow of the Royal College of Physician and Surgeon of Canada. And actually, when we were sent to study this subspecialty, was because it was a rare subspecialty at that time in 2003. And I was so pleased to help other women to keep their. I mean, I didn't think that I'm going to work with women until I started the program, and I found that 80% of my patients are female.
Yeah. I mean, talking about that, Dr. Fawzia, they always say it's very intense to work with female,
Yes.
They're always into pressure. They're always frustrated. I mean, working in a woman environment, thank God, our environment is peaceful, but yet it's very challenging in a way, right?
Indeed.
It's very challenging, but actually, I think women understand women more.
Exactly.
Our last year of medicine, the graduation, we had to do graduation and research, and we were 5 girls, and we
Yes.
decided to see what's the gender preference of healthcare providers among females. And you will be surprised, although men are related to muscularity, a lot of women choose to have a female health provider because they wanted to feel more at ease.
Yeah.
And to be honest, things that goes, whatever you're going through,
Right.
I've been through, and we all, it's
Understand
easy.
each
Yeah,
other.
it's easy to tell me things versus when you're talking to a male physician. Sometimes you either feel not comfortable to tell him things, or sometimes you think he never. Just
You'll
like
never get me.
Yeah.
Just like talking
matter
to a
what I
male.
say, yes,
Yeah.
no matter what I say, you'll always say, you know what, you're exaggerating. This is
Exactly.
overrated. You're looking at it in a way, you know. Yeah.
So indeed, doctor, I think this actually proves the point where a female patient do actually prefer to go to female doctors. I thought it
Definitely.
was, sometimes it's just a personal
Yes.
preference, but you actually proved it, doctor, that this is something true.
The first actual study was published in the Netherlands, and I was shocked because in Kuwait we have the cultural reasons, religious reasons,
yes.
but across the borders,
Universal.
every female feels more at ease to choose a female provider. But because of lack of females in medicine, definitely it's very challenging to have your own family, have kids, and
Right.
then be a physician. A lot of dropouts are mainly females, so that makes it more challenging to pick a female. So if you look at the search and you search a female in any subspecialty, you will find less females. But I mean, thank God in Kuwait we don't have that problem. A lot of females are physicians, and it's more easy to talk to a female with everything.
Right.
And definitely, when we studied hematology, and the first symposium or the first American Hematology Association I've been through, I went to 80% of the females in hematology, 80% of the physician in hematology were females. And I'm like, where are the males? They said, well, because most of the patients are female, most of the physicians are females.
Wow, that's really great to hear
Yes,
about. Yes.
yes,
So,
indeed.
as we were talking in the beginning, they always say it's very important to take care of your health through what you actually eat. So, when we talk about what we eat, we reach towards a point where we start to be, let's say, very picky in what we want to have and not to have, not thinking it actually could affect us in a way, and especially talking about our blood, which is the main source of many great things that actually get provided
Indeed.
through our body and organs. So maybe you'd like to tell us more about this kind of point and perspective.
So our blood goes through every certain organ, and it provides us with the important nutrients and different blood cells that protect us from infections,
Right.
blah, blah, blah. But one of the most important thing is the red blood cell, which carries your oxygen to every certain organ. Once your oxygen level is low, then these organs don't work. So if your oxygen is low to your brain, let's say you have brain fog. So if your oxygen is low to your hair cells, you have hair thinning or loss of hair, baldness sometimes. If your oxygen is low to your muscles, you can't gain muscles even if you work so hard. If your oxygen is low to your internal organs, you may have some diseases like chronic kidney disease or even diabetes. Your skin could be dry, a lot of things. And so this is what I've mentioned simply was the symptoms of anemia. So a lot of females, let's say in Kuwait, 50% of females have anemia from the age of 12, which is the menarche age, until the age of 50, roughly plus or minus 5 years. And a lot of females don't know that this is a disease and should be cured. They think that anemia is part of you as a female. So when you have menarche at the age of 12, you're done. If you tell your mom you have anemia, oh, I had it before you, you're not gonna die, it's fine. And as you said, a lot of girls in this age group would like to be models, and they will stop eating healthy stuff and follow whatever the social media will tell them, or these influencers sometimes.
Unfortunately.
They're promoting bad healthy styles.
Even for now, the body lost, which you're injecting yourself with insulins and stuff like that. I mean, a lot of people now tend to stop eating is because of these mini injections that they're taking. So yes, indeed.
Yeah, and a lot of girls grow up with this mentality, and unfortunately, bad nutrition leads to bad blood, and then so this anemia will affect them even psychological. So a lot of these girls and even the mothers, they'll have depression. They will be irritable. So these young girls will be very irritable. You cannot talk to them. They're very angry. Part of it is their anemia, and they don't know that. Achievement, like in their academic achievement, will just go down. So instead of, this is your time to, rise
Flourish
and shine, and
yourself,
and get some grades when you're in the high schools, to go to a good degree, to go to a good college or something. So it affects the rest of your life. And if you're anemic between the age of 12 and 18 and you're not seeking help, that's where it affects everything in your life. A lot of girls lose their hair, most of their hair, in that time. They tend to be pale, yellowish colors. They have cracks in their mouth. Sometimes their sleep quality is so
poor.
bad, and they sleep day and night and they're not satisfied. And the mother will say, well, she doesn't wake up at all. She's always sleeping. She goes to school, she's sleeping. They don't be involved in any kind of sports. They don't go out. They're very depressed. They're just staying home, and nobody knows what's wrong with them. And then one things lead to another. Finally, they discover they have anemia. Sometimes it's very late. They're like in their 20s, and they already lost the chance to go to study good, subject, or go to good college. They're smart, and they're labeled as lazy or, whatever.
Indeed, yes, doctor. You also mentioned all of these side effects, whereas hair loss and irregular sleep pattern. So if by the age, as you mentioned, 12 to 18, and the woman is diagnosed by anemia and did not get the chance by this age to actually seek help or seek a doctor, so after this age, if she did not seek any help, will this affect her lifestyle or her daily life, or can she go back, or can she actually help herself after this age to get back to having a healthy life, or if she passed this age she cannot go back again?
So definitely the quality of life is what we look at, and it's affected from the age of 12 to 50. And at any point, if you discover that you have anemia and you seek medical advice, definitely you'll be treated. Once you're been diagnosed, right, and you've been treated, then you're done. Anemia is reversible if it's an acquired anemia. If it's inherited anemia, and by that we mean you've gained a gene defect from your parents, whether one or two, and sometimes you have a disease like thalassemia or sickle cell, or sometimes you just have a trait. A trait means that you've acquired one affected gene from one of the parents, not both of them. So you look healthy and your blood test will look healthy for non-hematologists. And they would think, okay, just eat some meat or eat some beetroot and you'll be fine, but doesn't correct. Or they give you a course of iron and it doesn't correct. So your GP will definitely at this point refer you to a hematologist to find out what's wrong with you. So sometimes these acquired anemias will improve, and we can improve. Sometimes these girls are labeled as, that they have psychological pain because they're complaining of pain and they have no disease.
Right.
And they will mainly they will have chronic fatigue. They're very tired. Let's say if they work, their work boss will be so upset because she gets tired quickly. She sleeps, and sometimes she have pains and aches here and there. And a lot of these sickle cell patients, let's say, there's a percentage of them that can develop some sort of a rare renal cancer, only in the patient who are carrier to sickle cell. It's only discovered if you see a hematologist once a year. I mean, a lot of our patients don't come to the clinic every month like other chronic diseases, but at least if you come once a year, then you're safe. And when it comes to acquired anemia, let's say the iron deficiency anemia, this is the commonest, but there's other causes of deficiency. So let's say people who have B12, folic acid, they all affect your hemoglobin level. And definitely the B12 has not taken its position in the general public. Nobody knows about B12 anemia. We call it megaloblastic anemia. And that's one of the dangerous anemias. Even I think of it as more dangerous than iron deficiency anemia, because if it happens, you know what's going to happen? You will lose the function of your neurons and neurological function, and it's irreversible. So let's say if you lost sensation in one part of the body and you seek medical advice, let's say 10 years from now, the doctor cannot reverse these symptoms.
Side effects.
And some patients were diagnosed with other rare neurological disease, but in fact, it's only B12 deficiency. And the most common people that I've seen in Kuwait are the post-bariatric surgeries. These patients will have definitely all kinds of anemia, specifically B12 anemia, and they don't know because they've been doing follow-ups for like a year, and that's it. And then what's after a year? They don't know that having a bariatric surgery is a lifelong procedure, and you should be seeing a doctor, whatever, internist, hematologist, twice a year to make sure that you're fine.
Okay.
Folic acid also is another vitamin that's very important, goes into your DNA. Every certain cells in your body that has a DNA will use folic acid. And if you're deficient, for whatever reason, whether it's malnutrition or because you've done these bariatric surgeries, or some people have more common thing like H. pylori. It's a bacteria, very common. 80% of the population has it. And it affects your stomach, so your stomach cannot absorb all the nutrition.
So we can see that there are so many things that could be really affected, not knowing what's the cause and effect of it, and we have to really be aware of it. But we're going to continue, of course, about this topic, but let's head towards our first break.
You know, Hiba and Dr. Fawzia, we were talking actually previously about the side effects of anemia and how it is, very popular nowadays. Or as you've mentioned, most Kuwaitis or women at least are, as soon as they hit age 12, they are immediately, diagnosed with anemia. So what are the things that we should definitely take care of just to avoid these side effects even at a very late age, like mid-20s, if the side effects keep on happening, such as fatigue, dizziness. Many people, all of their life suffer from hair loss. It's like from teenage until you're older, you still suffer from hair loss without any effect. So is it the lifestyle that plays a big role in this, or does it necessarily need to be medications?
So the hair loss is actually complicated. The hair is made of proteins, a lot of fibers, multivitamins. There's a lot of things going on, hormones, stress. A lot of things can cause hair loss, and there's also genetics.
Indeed.
So the familial hair loss is actually very common, and it's basically when you have a very thick hair at the younger age, and once you hit the mid-20s, you lose most of it. It starts very early. The hormonal starts about the 40s, basically, and aging at the age of 40 plus. So it's multifactorial, but definitely malnutrition plays a big role, especially at the era of being so thin and like the famous celebrities. And a lot of girls just follow that, and they prevent themselves from eating enough, and so they're protein deficient, they're vitamin deficient, especially iron, vitamin D, zinc, and when they're deficient, the only way to put them back on the track and maintain their hair integrity is to start them on treatment. And this treatment could be tablets, could be IV, depends on the condition. Starting actually earlier when it comes to hair loss is very crucial. There is actually a paper published in last July that says if you lost hair for 3 years, the chances of regaining that hair is almost none.
Never. Yes.
Yeah, and then we're gonna go to hair transplant, and that shows us that once we have some hair loss, we should all go to seek medical advice. A lot of girls are shading hair like cats everywhere. The floor is filled, the pillow everywhere. The bathroom is plugged, and actually they don't seek medical advice, thinking that this is normal. Every girl knows what's normal hair loss and what's not normal.
Yeah.
I mean, the hair is part of the beauty of a woman, and no woman can look at herself beautiful without a hair.
Yeah.
And we go through phases in life. So if you get pregnant and you have post-delivery, post-breast lactating, you will lose a lot of hair, and you have to maintain the hair volume. Plus the hair integrity. You don't just want a volume, you want integrity. And that when you do that, when you want that, you have to seek a healthy lifestyle, starting with your food, maintaining a good healthy food. And if you've been through, let's say, bariatric surgeries or been some diseases that prevents you from absorbing normal sources, you have to go through parenteral or oral tablets to maintain your iron, and most girls, to be honest, in the clinic, they will come because of the hair loss.
Yes.
And then when I start asking them questions, have you fainted before? Oh, a lot of times. You don't think that's a problem? No, it's okay. I'm used to fainting. And actually, one of my subjects that I've done research was syncope, or like fainting, and falling in elderly. So I did a test or a study on elderly above 70, because in Canada they call, if you say elderly to a 50, they'll kill you. So it's 70 plus.
70 plus.
And most of them had fall because they had anemia. And the fall is the beginning of the end. So they'll fall down, they have either fractured bones or they have intracerebral bleed, and that's it. They change completely from a fully functioning person to a fully disabled person that will need a lot of help.
Yes.
So a lot of females, especially elderly females, we think they're protected from anemia because they're not menstruating anymore and they have no menstruation, so they're fine. But they're not. They're still at risk. So even this program is about females, so every certain female is a female. So even the elderly female, our mothers, our grandmothers, should have been checked once or twice a year. I mean, they don't have the same risk as the younger females who are menstruating or having kids or lactating,
Yeah.
because all these things will suck up your blood. But even elderly females. So these are one of the population that nobody looks into. And if they have, let's say, heart disease or have some sort of cancer, the
Yes.
first sign on a blood work would be anemia. And a lot of physicians will ignore that because she's a female and will say, okay, it's part of, but she's not menstruating,
Thinking
she's
it's
not
normal.
lactating, she's not having kids. Why is she anemic at this age?
Yeah.
Well, it's diet. Fine. When it comes to me, if I see anemia in an elderly female or a male at any age, my alarm goes up because I think this is abnormal.
Yeah, well, that's really quite interesting.
Yes.
You know, raising that point, I think a female would always immediately indicate that, raising it towards that you should really go to a
Yes.
female physician.
Yes.
But nowadays, it's not only about that. What I've seen recently, and I want you please to correct me if I'm wrong, there is also the autoimmune diseases nowadays that's been very popular and happening towards among very women that we've facing in our society in general. So I have this a friend who has a cognitive tissue disorder, and she's not, let's say, having the disease, but she's a carrier, and it was affecting her in a way that even when it comes into her blood, she was even diagnosed by being rheumatoid and stuff like that. So these kind of diseases, talking about the immune diseases, could really affect also, or let's say indicate into having also anemia in a way.
Yeah, so autoimmune diseases are part of, people with autoimmune disease can have anemia. But anemia is not a cause, it's an effect or side effect or a sign.
Of the disease, yeah.
Just like the people who have renal disease, they will have anemia. Anemia is not going to cause their disease, but their disease will cause anemia because they're losing the hormone that promotes your RBC or red blood cell production. So people with autoimmune, honestly, autoimmune disease is very common since the first time. Yeah, I mean, when I first went to school, I was telling my parents there's like this cool disease that we learned about, and they're called autoimmune, and nobody knows about them.
Right.
But I think with time, promoting more education through programs like this, telling people, like, if you have the symptoms, please seek medical advice and check yourself. A lot of people now know that they have. Just like depression in the past, no woman will go tell about herself that she has depression. She's crazy if she goes and checked herself for depression.
Yeah.
A lot of females are more prone to depression than males because of they're fragile. They have lots of responsibilities inside, outside the home. So when it comes to autoimmune disease, they're there from the beginning. But I think the education bring them to the service,
and that's very important.
Yeah,
indeed,
and
yes.
it has a stigma kind of, and in the past, no one will tell you that they have autoimmune disease, thinking that it's contagious or they can't,
Yeah, because any disease is actually could be transferred to another, so people would immediately feel about that. But speaking about depression, I have a very interesting story I have to share with you. But let's have this break, and then we'll be back.
I know, Hiba, you said you had a story about depression that I would really like you to share it with us. And also for Dr. Fawzia, you definitely told us that depression and anemia are related in a way. So also we would like to know, how is that related?
So definitely, the first signs of anemia, especially iron deficiency anemia, is depression. A lot of girls will come and say, in Kuwaiti terms, that I have no intention to do anything. Mali khalq. Basically, that's the magic word, and it's basically depression. She doesn't want to get up in the morning. She doesn't want to change. She doesn't want to go out.
Right.
She doesn't want to exercise. She doesn't want to take care of herself or the people around her. Even if she's a mother, the first sign she will lose engagement in anything to do with the family, and that's a big sign of depression. And guess what? Even if you're an antidepressant, sometimes they don't work until you fix your underlying problems.
Yeah.
So fixing the anemia will definitely, I've seen it in the practice, bring down your medication dosage, bring down maybe your 1 or 2 or 3, and then you'll go down to just 1 because you've fixed the underlying pathology. There's a mix. Sometimes you definitely need the antidepressant to fix your problem, but if you have anemia on top or other, like vitamin D deficiency, which is very common, your depression will get worse. So if you fix these problems and you become more healthy, then even if your antidepressant will work. Sometimes you think the antidepressants are not working.
Right.
Speaking of depression and divorce, depression is one of the major reasons of divorce. And 50%, we've done a research also when I was studying in Canada, and we found 50% of the divorced female were actually anemic.
Wow.
They had depression, but they're
Yeah,
anemic.
it's because of being anemic. Oh my God.
And I had a
How
case
very
once, we fixed her anemia, and she went back to her husband, which is very good.
Wow.
So it's really
Speaking
related.
yeah.
Yeah.
Being anemic as a female, as a mother, as a wife is not a good thing, and it can end your life
Right.
because you don't have tolerance for anything, and you see the small problems as really big,
Very
and
huge and big.
that your tolerance goes down, and this is the end of the story.
Yeah. I mean, my start when it comes to depression was after delivering my first child. It was very frustrating. I remember the days that I was very depressed, and all of my family, like I was telling everyone I'm going through depression. Like I immediately noticed that this is not normal. And it was after delivery, and it's all because of the blood was really low, and everyone was trying their best to let's say chill me out, and it's fine, it's just a phase. It was very difficult, very challenging. Like everyone would see my relationship with my first daughter is so amazing now, but let me tell you, it was very bad in the beginning. Like
I hear you.
I
was
used
not
to
easy.
say that she ruined my life. It's all because of her coming into this world where my life is actually becoming very strict and very narrowed in a way, and it was all because of the blood.
And you didn't enjoy,
Yes.
that beautiful moment.
Like I have this kind of, let's say, fearness of being pregnant again is because of going through that kind of phase. Like I don't want to go. Like I had my second child, and I was all the time being happy and trying. Though my second child, my blood level was very low. It was the worst. Like I used to have blood through my veins, and it was very, very tiring. But because I've been through a kind of let's say a phase in pregnancy, I didn't want for it to go to my second pregnancy and leave it in a way that I'm not going to enjoy my time and my moment with my child. But it was very challenging.
True.
So it's a very important point to keep in
I
mind
agree.
to everyone, that it's one of the cases that you really have to keep it in the top of the priority of the woman being at home, that they go through depression. It's not because it's a myth, or you know, especially when it comes
They're
into our
seeking
mom.
attention.
Yes,
Yes.
you're seeking attention. This is what you want to do and stuff like that. Like we've been pregnant, we didn't face that, so might as well you won't face it. But in fact, it is, and it's
is.
something true, and it
By
could
science,
actually
by
happen.
facts,
Yes.
by evidence.
I mean, we've been
Indeed.
talking about it a lot, and this would lead us to talk more in different episodes. I'm very sure everyone is really eager to know more about anemia, since it's a very pop topic that's being held. But for now, we're going to leave it for today and continue, of course, in the next episode.
Yes.
Pleasure to meet you all, and we'll see you next time.